I think the evolving field of precision medicine is really based on identifying unique features of an individual patient's tumor. And in that sense, diagnostics are critical to defining, for example, what some of the mutations may be in some of the genetics of an individual tumor. And increasingly, we're designing therapeutic plans, based on a really thorough understanding of what's going on in those cancer cells. And so I think as drugs are getting developed that target specific pathways in immunotherapy, we're beginning to have an understanding of predictive biomarkers. And I think these will be important for really developing treatment plans for patients. And so as drugs get developed, I think having companion diagnostics or some connection to that field is going to be increasingly important. I think a good example really comes in melanoma, where for many years we understood that there was a mutation in BRAF might be an important target, and it wasn't really until we started selecting patients for clinical trials of BRAF inhibitors by first defining whether there was a mutation in the BRAF gene that we started to see really dramatic effects. And there is also a perfect example where the FDA has approved a companion diagnostic, and payers currently require that before treatment with these agents. I think it's also, there's some limited data now suggesting that treatment with a BRAF inhibitor in patients with the wild-type BRAF might actually be deleterious and may actually cause progression of the tumor. So I do think that the connection between what we're doing diagnostically and therapeutically is probably more important than it's ever been in the past.